I'm assuming you're here because your dentist told you and you need to get a root canal done. Or maybe your teeth hurt and you can spot a deep cavity. I know, I get it. A trip to the dentist isn't a comfortable one, especially big words like root canal therapy or cavities or multiple sittings. You need not worry. I'm here to solve all your problems and put your mind at ease. In this video, we will be talking about root canals, about why and when you might need them and how you should set your expectations. Look into the mirror, open your mouth wide. Do you see any tooth discoloration? Any stains? Do you see any holes in your teeth or pits? You could have a cavity. Does it hurt to chew? Are your teeth sensitive to temperature? All of these are indications of a root canal treatment. Occasionally, you might encounter an infected pulp inside the tooth. Various reasons can be the cause: chipped teeth, injuries, cavities, or simply tooth decay. When the pulp gets infected, your dentist needs to clean it out and fill it up. This is essentially what happens in a root canal procedure. It is pretty simple and straightforward. Do not worry. You might be wondering, this sounds pretty similar to getting a filling. Why do you need to go through the long process of a root canal procedure and even pay more when you can just get a filling instead? After all, fillings are cheaper, less complex, and need only one sitting. Here is how you're wrong. Fillings work when there is a little decay in the tooth matter, but when the damage is deeper, that's when we usually prescribe some root canal therapy. You should let your dentist diagnose the treatment you require. Let me walk you through what will happen when you're going to get a root canal therapy. The entire process might take up to 3 to 4 sittings. Firstly, there will be an X-ray of your teeth. The X-ray is to ensure you don't have other underlying problems and to get a clearer picture of the affected area. After this, they will administer local anesthesia before beginning the procedure. There will be a dental dam fitting. This is a thin sheet to separate the infected one from the rest. After this, there is a small hole made in the tooth crown. This is to make space for tools that will clean up the infected pulp in the tooth. These tools are very small and slender and won't hurt you at all. The inside is cleaned with antibiotics. This ensures that no bacteria remain in the pulp, gums, or nerves. This is followed by filling the tooth with a material called gutta percha. Gutta percha is a biocompatible, rubber-like material. It is the extract from the Japanese percha tree and is completely safe for you. To seal your tooth and the filling, adhesive cement is used. Sometimes you may be fitted with a crown or a bridge. Getting a crown is usually the final step of a root canal treatment. It is okay if you are apprehensive about getting a crown. Many people are, but remember, crowns are essential for your teeth, especially for molars that need to exert force while chewing or biting. So if your dentist is recommending a crown, I suggest you get one. Better safe than sorry, always. If multiple teeth are damaged in a row, you might get fitted with a bridge. These will cover all the damaged or missing teeth. Crowns and bridges can also be custom made. This can be according to your preference of color and material. In rare cases, you might need to get a post fitted in your teeth. This is because your teeth might lack the structure to support the crown or bridge. However, this is not a common occurrence. But even if it is something that is happening to you, relax. Ask your dentist. They will be happy to provide you an explanation. Don't worry about getting pain. You won't. Newer technologies and local anesthesia will prevent any pain during the treatment. Your teeth might feel sensitive between settings. This is normal. There is a small chance you might feel excessive pain after the procedure or even between sittings. If it is so, consult your dentist. Sometimes over-the-counter painkillers also work. But if you see any blood or abscesses, something might be wrong. In any case, make sure to schedule a follow-up session after your last sitting. Let me share some simple tips for root canal aftercare with you. I would suggest not having any food until you stop feeling numb in the mouth. Avoid hard foods like meat or nuts. Also, don't eat chewy substances like candy or toffee. Try to eat only soft foods and drink a lot of liquids. Make sure to avoid alcohol and fizzy drinks. Take care of your filling. Don't brush too hard. It is okay for a layer of filling to come off, but if the entire filling has come out, you should rush to the dentist. Getting a root canal will be beneficial for you. It will eliminate tooth pain. It also protects teeth from decay and wears. All my patients have expressed extreme relief after getting root canal therapy. Some of you might experience a little sensitivity or an uneven bite a few days after the procedure. You can treat this easily at home by taking warm water or using a numbing gel. You can also use a cold compress against your jaw and cheek or take mild painkillers. Make sure to avoid smoking after the procedure. Smokers have a high chance of needing such procedures as compared to non-smokers. Follow all the advice and instructions given by a dental practitioner. Hopefully, watching this video cleared all your doubts and made you less weary of root canals. Now go get it done then. Trust me, you will be very happy with the results. Now that you might realize these tips take quite a bit of time and effort, and I understand if you have a teeth problem, you want to get rid of it as early as possible, right? That is why I put together a free practical guide for healthy teeth to make this easier for you. With this, you'll never have to worry about teeth problems ever again, because it will teach you exactly how to keep your teeth healthy. So click the link in the description now to get your free download. And if you want more videos on how to max your oral hygiene, make sure to subscribe so you don't miss out on our future videos.